Hi, my name is Robin, and my project is going to cover the mechanisms, risk factors, and treatment of allergies. First, I will go over the introduction, mechanism, risk factors, treatments, and lastly, the conclusion. Introduction. What are allergies? Allergic reactions are our bodies releasing adverse immune responses to harmless substances called allergens. To most people, allergens do not cause any trouble. However, an allergy patient's immune system misinterprets the allergen as a harmful substance and releases an immune response to attack it. While some reactions are mild like coughing, sneezing, and itching, there are also more severe reactions like anaphylaxis. Anaphylaxis is an allergic reaction that causes airways to constrict, resulting in breathing difficulties. According to the CDC, in 2021, 1 of 3 American adults were diagnosed with allergies, and 1 of 4 American children were diagnosed with allergies. With the growing number of allergy patients worldwide, this project hopes to raise the awareness towards allergies and provide guidance to allergy patients. Understanding the different risk factors, available treatments, and the basic mechanisms of allergies is crucial for improving the life quality of allergy sufferers worldwide. Mechanism. A person becomes allergic to an allergen when an immune system recognizes the allergen as harmful. Some examples are foods, animals, plants, insects, and pollen. Once the immune system's evaluation of the allergen is complete, it produces specific antibodies, often called IgE, to fight the allergens. These antibodies then bind to inflammatory cells. Upon the next exposure to the same allergen, the inflammatory cells are triggered to release inflammatory chemicals. This causes the typical allergic symptoms like swelling, runny noses, and watery eyes. Since we do not know when the immune system will mistakenly attack an allergen, people often develop allergies toward allergens that are commonly found in the environment. These specific antibodies in their body ultimately makes us sensitized, or in other words, allergic to the allergen. Risk factors. Changes in exposure to allergens. Our immune systems are more prone to releasing immune response to sudden exposures. For this reason, drastic changes in the environment or the encounter of new allergens can act as a trigger to allergy development. An example of this is migration. When people from urban areas move to rural areas, they often encounter many allergens that they were not exposed to precedently. For this reason, compared to those that lived in rural areas for multiple years, they are more prone to developing allergies. Even if it is not from urban to rural, there are allergens that are more common in one place than another, meaning these new allergens that the immune system is not used to can also bring the same effects as well. The route of allergen exposure can also serve as a significant risk factor. For example, eczema patients have higher chances of allergy development, especially food allergies. Their weaker skin barriers allow food allergens to introduce to the body through the skin instead of the mouth. This abnormal route increases the chances of immune system releasing an immune response. In fact, 30 to 39% of eczema patients have food allergies, while only 0.1 to 0.6% of the general public have them. Environmental factors also contribute to allergy development. In particular, nitrogen oxide, which is emitted from factories and cars, is seen to promote the development of airborne allergies. Researchers tested 2 groups of mice to test nitrogen oxide's impact on allergy development. The experimental mice were exposed to nitrogen oxide for 30 minutes prior to their exposure to OVA. The control group skipped the nitrogen oxide exposure and were only exposed to OVA. Because OVA is a protein that generally does not provoke an immune response, This study used OBA to determine the impact of nitrogen oxide. By the end of the study, experimental mice showed the evidence airway inflammation. Through the study on mice, it is recommended that people with higher risk for allergies avoid highly polluted areas. Genetic predisposition also contributes to allergy development. For instance, MALT1 gene is being seen as a significant factor to peanut allergy development. MALT1 gene is a key protein in immune responses. For this reason, a person with a defective MALT1 gene often has a weaker immune system compared to others. In the Learning Early About Peanut LEAP study, the children that developed peanut allergies were often found to be MALT1 carriers. Through this study, we can claim that MALT1 promoted the immune system's reactivity towards peanuts, thus contributing to the children's peanut allergy development. Treatments. One of the treatment options we have are pharmaceuticals. A common pharmaceutical treatment for allergies is antihistamine. Antihistamine is a drug used to treat allergic symptoms caused by histamine. They are commonly used for allergic rhinitis. To understand how antihistamines work, we need to know how histamines work. Histamine is an inflammatory chemical released during an allergic reaction. When histamine binds to its receptor, an inflammatory response activates. To reduce the histamine's effects, antihistamines binds onto the same receptor to deactivate it. Some side effects of antihistamines are dry mouth, dizziness, insomnia, and drowsiness. Corticosteroids are also a common pharmaceutical treatment for allergies. They are often used against allergic rhinitis and anaphylaxis. Corticosteroids are man-made steroids that mimic the properties of glucocorticoids and mineralocorticoids. Corticosteroids inhibit the production of inflammatory cells and immune cells. This causes the entire immune system to be suppressed. With the immune system weakened, allergic symptoms weaken as well. Side effects of corticosteroids are weakened bones, diabetes development, neuropathy, and immunosuppression. The third pharmaceutical option is Xolair injection. Xolair injection is a monoclonal antibody that binds onto IgE, preventing it from binding onto its receptors. Unlike the other two options, Xolair injections are not used for immediate relief. Instead, they are used to prevent severe allergic reactions in case of accidental exposures to food allergens. Some side effects of Xolair injections include injection site reactions, meaning swelling, redness, and itchiness, and also fever. Although Xolair injections are allowed to be injected alone, it is recommended that they are given at a healthcare in case of severe side effects. Moving on, next up is therapeutic treatment options. A common treatment in this category is immunotherapy. Immunotherapy is when allergy patients receive increasing doses of allergens to build tolerance against them. Within immunotherapy, there are also two options. The first is subcutaneous immunotherapy. Subcutaneous immunotherapy, also known as allergy shots, are administered under the skin. They are best for allergic rhinitis and insect venom allergies. Since the side effects of subcutaneous immunotherapy can range from mild to severe, it is required to stay at the office for 30 minutes after administration. The second type of immunotherapy is sublingual immunotherapy. Sublingual immunotherapy is administered under the tongue. They can be in the form of either a tablet or an allergy drop. Tablets are best for ragweed pollen, rats, house dust mites. Allergy drops also work well with those mentioned for tablets, but can also be used for tree, cat, dog, and feather allergens. Side effects of sublingual immunotherapy include skin reactions or irritation, nausea, and itching eyes. Unlike subcutaneous immunotherapy, sublingual immunotherapy can also be used for food allergies. Though this may seem extremely strange, parasitic worms can also improve allergic symptoms. When parasitic worms invade the body, they release chemical messengers to shut down the immune cells. This suppresses the immune system and prevents it from attacking parasitic worms. When the immune system is in this state, its ability to produce allergic reactions also subsides. But despite the effect, parasitic worms absorb the nutrients in our body as they settle in our intestines. For this reason, malnutrition is an unavoidable side effect. Compared to immunotherapy, parasitic worms still have a more to be researched to serve as a safe option for allergies patients. Now we have the preventative treatments. One way to prevent food allergies are early exposures. In the Learning Early About Peanut LEAP study, the experimental group of high-risk infants had increasing doses of peanuts during 4 to 6 months of age. During the same time period, the control group avoided peanuts instead. When the two groups were tested for peanut allergies at the age of 5, researchers found out that the experimental group's prevalence of peanut allergies were decreased by 80% compared to the control group. Extending from this research, persistence of oral tolerance to peanut leaf on proved that the peanut tolerance the children have built persisted even after an year pause of peanut consumption. Through these studies, early exposures are recommended to other food allergies like milk, egg, and fish as well. While food allergies can be prevented by early exposures, some other allergies are simply best through avoidance. Allergen avoidance does not give the immune system the chance to be sanitized, meaning allergies cannot be developed. Though this concept cannot be applied to allergies like pollen, which are practically everywhere, they can work for cat and dog allergens. Moreover, allergen avoidance is also the best solution for preventing allergic reactions for people who are already allergic. Conclusion: allergy patients are everywhere. Yearly, they suffer with symptoms that constantly decrease the quality of their daily lives. But despite the fact that allergies are not a popular field of research, although innovative and effective allergy treatments are important as well, as ordinary people, we can also help by reducing plastic use and using carpools to reduce the amount of chemical byproducts from cars. With less pollution, the risk of allergy development decreases for many people around us. With current treatments and future research, we hope all allergy patients receive the help they need. Thank you for listening.